The broadcast is now starting. All attendees are in listen-only mode.
So welcome everybody, welcome to today's Health Choice Network and Alliance Chicago in Action COVID vaccine. Today we have a targeted populations, kids and moms. So we have a great set of speakers lined up for you today. So let's get started. And if we advance the slide to our overview here, you're gonna see we have a word from our Chief Executive Officer, Dr. Fred Rockman. Then we're going to hear from our colleague about some vaccine updates. And then we have a great lineup of speakers. We're going to hear a perspective from Denver Health. We're going to hear a perspective from Chicago Department of Public Health. And then, most importantly, we're going to hear from our healthcare heroes at our health centers, Tampa Family, Heartland Health Centers, and Jesse Trice Community Health System. So we're glad you're here with us today. And so let's get started. In general, we like to start with a word cloud. So if possible, why don't you take out your cell phone, if you have your cell phone with you, and put in the message line 22333 and who it's going to go to, and then put in COVID-19 heroes, and then you'll have a response come back and say you are linked up to our live word cloud, and we have an interactive question we'd like to ask today. So get out your cell phone, in the to line, put in 22333, and then in the message box, put in COVID-19 heroes. And so if we go to the next slide, our word cloud for today is, what are you thankful for this year? So as we approach Thanksgiving next week, hopefully you're thankful for something, but we want to hear at least one thing that you might be thankful for. So again, take out your cell phone and we want to hear from you. Put in a word or two. What are you thankful for this year? We're getting some slow responses in. We have family, vaccines, work. I don't know who that was. Friends, health. Let's hear from a couple more. Keep them coming in. Keep them coming in. Family, friends, work, vaccine, health, friends. So hopefully we all have a number of things to be thankful for this year, and we'll keep this word cloud going. So if you want to join us throughout our webinar today, that would be great. So next, let's turn it to our next set of slides. And we're going to hear from one of our CEOs from Alliance Chicago. And we will listen to our colleague, Fred Rockman, who's going to give us some high-level information about what's going on lately. Brad, are you with us today? We will wait for Fred to join us. There we go. Hey, Fred. How are you?
How about now?
You are great. Loud and clear. Coming in from Chicago.
The obligatory problem with the mute button, Tim. What can I say? So anyway, listen, really always just so energized and thrilled to be on these calls, and just honored to have the opportunity to say a couple words of welcome. I'm not going to take very much time at all today, but as we go into this holiday season, I wonder if we could bring up the slides. You know, we're looking at this season with a little bit of some somber noting that that trend of improvement is now turning in many states into a little bit of an upturn. Were we able to get the slides or no?
We are seeing the slides. We're on the daily.
Okay, great. I'll assume you're seeing them. I can't see them, so I'm flying a little blind, you all. We are seeing a little bit of an upturn in the COVID cases, of course, but on the positive side, if you just go to the next slide, headlines again are showing this upturn in the slides, in the cases. and causing us to want to exercise a little bit of caution. That's tempering a little bit our enthusiasm for our holiday celebrations. Just want to urge all of you, and we need to urge our patients to exercise that little bit of caution and maybe use it as the motivation to encourage folks to get immunized. But then, of course, on that positive note, we continue to make, next slide, steady progress in immunizations. You all at health centers, we all at health centers over the first 10 months have been responsible for more than 6.8 million doses, more than 600 or close to 600,000 of those in adolescents. 75% reflective of our populations are in ethnic minorities and disparity populations, and 38% of those vaccines are to special populations. So awesome work that we have been doing. And of course, now we're heading into boosters and pediatric immunizations, and especially delighted as a pediatrician that we're talking today about kids and moms. Next slide, please. So what are we grateful about? Well, first of all, in addition to all those vaccines, we're grateful that the evidence is that they are super effective. And in fact, when you look at the statistics and who it is that's being impacted by these surge, overwhelmingly those who are not immunized. Those that are immunized have more than a 6-fold chance of testing positive, and greater than an 11-fold chance of dying from COVID. So this work that everyone is doing is just awesome. So if you can go to my last slide, please. This is my own personal COVID gratitude list going into the Thanksgiving holiday. What am I grateful for? Well, first of all, that encouraging data on the effectiveness of vaccines, the fact that we're now freed up to give booster vaccines to even more folks, that we're broadening the vaccines to cover our kids, and all of the federal resources that we have at CHCs. And if you could just hit that advanced slide one more time, mostly grateful to be amongst this awesome workforce that we have at CHCs and the work that we've been doing together around COVID. So with that, I'm eager to hear our speakers. Tim, thank you.
Great, thank you, Fred. It's always great to hear from you, your words of encouragement. And yes, our healthcare heroes are certainly people to be proud of. So thank you very much. So if we advance the slide, we are going to hear from our first speaker. Shelley is one of our colleagues at Alliance Chicago, and she is going to give us some updates on COVID-19 vaccine. So Shelley, how are you?
Good you everyone. Happy to be here. Hope everyone's doing well today. We can go to the next slide, please. So as you've just heard from Fred a little bit about this, we are seeing a continued incidents, cases of COVID-19 occurring, unfortunately. And as we see with time, the Delta variant is really starting to reduce in the areas that it hit hard over the summer, and so we see the hot spots elsewhere. As of today, 47,313,475 people have been reported to have had COVID. Of course, there may be some folks that are unreported, so that number may actually be a bit higher. And unfortunately, sad to say, to date, we've had 765,919 deaths as a result of COVID. Next slide, please. So what I wanted to highlight on this slide, really, many of you may already have seen this or known about this, but what's happening now and very relevant to our conversation today is that we've seen since approximately the beginning of August, we have had an increase in COVID cases amongst children. So looking at this highlighted circle here in red, ages 0 to 4, 5 to 11, and 12 to 15, is that all those yellow lines you see with that little peak between the August 7th, 2021 dash line and the current line here. So unfortunately, we are seeing this, and it's very relevant today with our conversation, why we're here, working on getting everyone information on getting kids vaccinated. Next slide, please. And so I just wanted to really quickly just show you all, if you haven't seen this image, this is just an image to see all of the variants and several of the variants of Delta actually, and just exactly how in time over since January 2021, we've seen starting in late May, just an exponential increase of this variant showing up and how that's really the one impacting us overall at this time. And we're starting to see that little upward tick that you saw in that earlier visual from Dr. Rockman as well. Next slide, please. So as I've mentioned on previous webinars, just a quick update where we're at with our total vaccination numbers. Right now we're at 195.3 million, which is approximately a little bit less than 60% of our US population. So we still have a bit of a ways to go, which is why even more so it's important for us to keep getting these children vaccinated. Next slide, please. On a positive note, I just wanted to mention, and you'll hear a lot more about pregnancy and COVID-19 vaccines from Dr. Robinson shortly, we are seeing a positive uptick of pregnant individuals getting the vaccine and, and just continuing in that vein of really increasing and understanding that it isn't going to impact their pregnancy and that it is safe to do so. Next slide, please. So there's a lot of text here. This comes from the CDC. And what I just want to highlight here in the yellow box really is that, one, the pregnant individuals that come into your office are eligible to get the booster. Please do get them the booster if you can, if it's safe for them to do so. And it's been more than 6 months since they've received their second dose of their primary series. And also just a reminder that it is safe. There's currently no evidence that any vaccines, including the COVID-19 vaccine, cause any fertility problems in women or men. And so if you have folks coming into you in primary care who are saying they're concerned because they plan on getting pregnant, there is really no evidence of any vaccine impacting that. Next slide, please. So this slide is just, and these slides will be available to you after the webinar. This slide is just highlighting a couple quick resources that may be useful to you all as you're working with your populations. And want to specifically highlight the last resource, mothertobaby.org. This one's really geared towards educating pregnant individuals so that they really feel empowered to make that decision for themselves in terms of whether or not they choose to get the COVID-19 vaccine. Next slide, please. So just wrapping up with a couple little bits around children. One of the key issues that we're seeing really is that of the 6,625,847 total child cases reported through the end of October, we are seeing that there is an increase of multi-system inflammatory syndrome. And as you can see, this really follows in line with when the child gets COVID, which is that sort of grayish black dashed line. And the blue line represents their multi-system inflammatory syndrome showing up. And really the deaths from that are just, even 48 deaths of children is just not okay. And I really want to emphasize our goal is to help you all and support you all in getting these kids vaccinated so we can prevent these types of terrible situations. Next slide, please. So what, just kind of generally, so everyone's aware of our population, there's 28 million children who are eligible under the new approved 5 to 11 Pfizer vaccine, which is about the population of Texas. And surveys have really indicated that 1 in 3 parents are willing to vaccinate their kids immediately and have maybe already signed up to do so. So really what we need to be thinking about is those other 2 that are not they're not ready for it, and we need to help support them and give them the tools to make that decision and make sure their children stay out of those statistics. About 11% of all total COVID cases are from children, as I mentioned those numbers earlier, the 6 million number. And we are seeing that of the hospitalizations, about 30% of them don't have any underlying conditions. And so really it's important at this time that we have these vaccines available and we get these kids in and vaccinated. Next slide, please. So this is a slide that comes from the ACIP CDC group, they met and made that decision very recently, as you all know, and this is kind of what helped them see that these 5 to 11-year-old children that are dying of COVID, while it's not overall a great number, that number is still a problem and rising as kids get older. Next slide, please. When you're addressing hesitancy, this particular slide may be of some relevance, so we know prior to vaccines existing for all of these conditions listed here, children were dying from these diseases on average, still lower average than for COVID-19. So it's really evident here that in the short time that COVID-19 has been present, we've had 66 average deaths per year, versus for things like varicella or chickenpox, where there's only been 16 reported between 1990 and 94, and just continuing to see that that number is so much greater across the board for every situation of these diseases that impact children. Next slide, please. So when using some modeling software, which I've included the link here for anyone who's interested, we really see that if we're able to get these kids vaccinated and we really accelerate and get these schools involved, as you'll hear about shortly, we could save ourselves 8% of children, or 600,000 cases not occurring over the next 6 months. So really, it just makes it even more obvious. It won't get rid of it, but it may really help us reduce the opportunity of a new variant coming out and really keep these kids from getting sick. Next slide, please. Again, further, just looking at the estimated benefits, we see if you break it down by identifying as female at birth children and identifying as male at birth children, we see that there's over 100,000 cases that will be prevented. And these slides come from the ACIP meeting, and they really talked a lot about this at the meeting, just the idea of keeping 60 females from the ICU beds and keeping 72 males from the ICU beds. That's phenomenal, and will save so much pressure on the health system and the already taxed healthcare workers, as you all know. Next slide, please. So I just want to conclude here with some resources, again, that may help support you all as you're working on getting your vaccines out to your kids. There's a variety of resources, and you'll hear about a lot more today with our speakers that are coming up. And with that, I'll hand it back to Dr. Long. Thank you so much.
Great, Shelley. That was great information. You always are right on time with the hot topics, moms and kids today. So thank you very much. So as we advance the slides here, we are going to have a poll question. And generally we do these poll questions to make sure people are still awake during the webinar and not sleeping. That is the purpose. But also we want to hear from you too. So we are going to have one poll question here, and you're going to use either your phone, or in a minute you're going to be able to click if you're looking at your computer screen. You can answer the poll either way. The question is, and I think it's going to be put in the chat, how has uptake been for kids receiving vaccinations at your health center? So A would be easy, little to no changes or challenges. B would be moderate, a few challenges, or C, difficult, we're facing many challenges. So you can vote once, I think, at least, of A, B, or C. And you can either do it on your phone by putting in the line 22333, and in the message line, put in COVID-19 heroes, and then that'll pop up and you'll be live in the poll, or you can do it here on the screen. So A, B, or C. Easy, little to no challenges. B, moderate, a few challenges. Or C, difficult, we're facing many challenges. So it looks like for those that did respond, it looks like B was the answer, moderate, a few challenges. So good to know. At least it's not C. So let's advance the slides, and we are going to have Dr. O'Leary join us. Hello, welcome. And she is going to talk to us about Denver Health. Hello, about school-based health centers. So Dr. O'Leary, take it away.
Yeah, go ahead and go to the next slide. So my name is Sonha O'Leary, and I am a pediatrician here at Denver Health. And I'm the medical director of our 18 school-based health centers, as well as the chair of the Council on School Health for the American Academy of Pediatrics. Next slide. So today, what I really want to talk to you about is how school-based health centers and schools can get together to do mini mass vaccine clinics. We're going to talk about what is a school-based health center for those of you who might not know it. We're going to talk about why school-based health centers are natural partners with school districts to provide COVID-19 vaccine for students and families. And then we're going to talk about how hard is it to create mass vaccination clinics. Next slide. It's really hard. It takes a village and it takes some amazing staff as well. So a little bit about Denver Health. Denver Health is a large safety net system that consists of one hospital with a level 1 trauma center for adults and a level 2 trauma center for pediatrics. We have a total of 10 community health centers, 18 school-based health centers. We also have one of the departments of public health and Rocky Mountain Center for Poison Control. So our school-based staff have about 100 of the 7,000 employees who work at Denver Health, and we are located in clinics that are right inside Denver public school buildings. Next slide. So school-based health centers, we started back in 1987. We celebrated our 30th anniversary about 3 or 4 years ago. And school-based health centers have actually been around for the last 50 years in the United States. Total visits, this in a normal year, we see 52,000 visits and touch about 12,000 students. And we see students from early Head Start all the way to high school, although we do see some kids all the way to 25 when they're in technical colleges that are associated with Denver Public Schools. Although we're the medical sponsor, we have a multi-agency partnership with some mental health providers. So inside a school-based health center, you get everything you get in a regular clinic. We do physical exams, we do well adolescent and well child checks, we do acute care, injury and illness prevention, immunizations, every immunization under the sun, including COVID now. We can do any lab tests. We can do blood tests, we can do urine tests, we can do strep tests. We're able to do prescriptions, but we also have a pharmacy inside our clinics to help our students get what they need. We do confidential services, so pregnancy testing, testing for sexually transmitted diseases, and birth control. We also have a very rich and diverse mental health staff and can do individual, group, and family mental health counseling, including psychiatric care. Finally, health education for that is specific for adolescents, dental services, and enrollment services. Next slide. So some of the big benefits of school-based health centers is that we remove access to barriers. And so a lot of those are cost. All of our centers are at no cost to families, and we do not take co-pays. Transportation, I'm actually in one of the high schools in Denver right now, and you can see it kind of looks like a clinic behind me, but it's really easy for kids to just come on in when they want to be able to get the care that they need. And we're here and don't cause creating, competing priorities. And so if they want to get in so that they can try out for the team and the deadlines today, we try to get them in to get their physicals in. We do actually do great continuity of care. For some kids, we are actually their primary care provider. For many, we're adjunct care, and we're happy to provide those services and communicate with their PCPs. One of the things that we have seen with school-based health centers is that because we are a medical home to a lot of kids, we provide high continuity of care, especially for those who are underserved. And finally, that because we're here, we limit out of classroom time. So a kid's only out of school for, one 45-minute period, as opposed to the whole day or half a day if they're going to an outside clinic. Next slide. One of the most important components of school-based health centers, and really what helps us put these clinics together, is our partnership with Denver Public Schools. So important reasons to have them in school-based health center areas are: one, you can leverage that partnership. So like I said before, we have been partners since 1987. We have a DPS liaison who is a liaison to all of our community partners and actually speaks, like we put here, large systems language. We have a large system, they have a large system. The clinic staff and locations were identified early by our DPS colleagues in supporting the roll out of adolescent specific vaccine clinics. We are safe and trusted locations. So we use the school-based health model for our vaccination clinics because it's the same as our model for school-based health. Kids and families are used to being here. They're comfortable coming here. It's not a place that they're nervous about. And finally, we can do vaccines for the whole family. So it's convenient. DPS was kind enough to pay their personnel, FMs and securities to attend our events, to stay after school. And DPS also worked with Denver Health to send email invites to 15 to 18-year-olds in the district, which was literally like 22,000 invites. Next slide. So talking about our vaccine clinics, these are the ones from last semester. And so we held clinics at 6 different sites on Saturdays and Sundays from 8 a.m. to about 4 p.m. So we had April and May, and then we had clinics in June as well. Those were on Tuesdays and Wednesdays from 12 to 4. And they were all over the city. So if I were to show you a map of Denver, you would see that we very strategically put these clinics in different quadrants to be able to reach different communities, including families and staff. Next slide. There was a lot of pre-planning that went into these clinics. This is just, showing you how we actually walked the sites, took pictures. Well, we didn't take this aerial picture, but we borrowed the picture, and then we were able to map out how we would do flow, where patients would come in, where next might occur, etc. Next slide. We also realized that it was important to have positions. So we needed to have stations and positions for people. So there was a traffic people. There is a screening table to screen for symptoms of COVID, a consent table, registration area in case your information, we didn't have it all, for example. Pathfinder, so a person that can take you from registration all the way to get your vaccine. The vaccine stations, mid-station tables, right? So we could put all the vaccines that were there once they were drawn up, that then they could be distributed. Post-observation table, so we had a place where all the kids and families could be, and they were being watched with our epi and Benadryl, just in case something were to happen. And finally, our vaccine management area that prepared all the vaccine. Next slide. So we also have to have different locations, and so we have the entrance, we have a traffic director's tent, a fast track cone, so that was, you had all your information in place and you can go straight to get your vaccine. Slower track cone, which meant that you had to go to registration to turn in a few things. And finally, you can see on the far right, we did vaccine stations in the hallways of schools, whatever it took to get kids vaccinated, especially at this time when, and now it's colder weather and there's rain. Next slide. We had a lot with our setup process, and so realized that we were going to do this in different sites, that we really needed to bring our A game and be super organized. So we have different vaccine site supplies, which are blue, purple, vaccine management, yellow, electronic carts for screening, check-in, and registration. Next slide. We also did a lot of work before the clinics, so trying to eliminate waste and optimizing patient flow, which included reminder calls to be able to get information, to remind people, to see if people didn't need their appointments anymore. We had to take a lot of verbals for consent verification for kids under 18, a super important part. And we had to make sure that our consents were all valid, especially after the pandemic began, and that there were different rules for being able to get consent. Next slide. We still do a lot of work during the clinic, and so we actually have tip sheets and guides and personnel training and walkthrough that occur right when people get to the clinic if they're volunteering or they're working extra shifts. We also eliminate waste by having at-elbow support during the clinics by having leads. So we have vaccinator leads. If you need a helping hand to soothe a kid, especially our young ones who are so scared of vaccines sometimes. Although I will say some of them take them better than a lot of 18-year-olds, just saying. So Rover lead, the Rover are the way that we were registering patients for their vaccines, and then the registration lead at the very beginning of the process. We also had people verifying reports, right? So we still don't want to waste vaccines. So we need to know who came in, did people no show? Can we support walk-ins? Making sure that our lot numbers are correct, and making sure that we have all our ducks in a row, have our vaccinators listed correctly. Next slide. The work doesn't end there though. After the clinics, there's still a lot to do. We actually would make sure that we had lists of stickers so that we could count, we could actually count and make sure that it lined up with the number of vaccines our Epic system showed us that we had done. We reported number of drawn up vaccines. So a lot of systems of checks and balances to make sure that we had things correctly documented and that we could tell the state exactly how many vaccines that we had given. Next slide. So this is just sort of a rough number of how many vaccines we gave. I think these were after our April and May clinics. And so you can see that we had 6 different sites, and some of our sites, especially, you can see School-Based Health Lincoln, School-Based Health Evidentis, which are in the southwest part of Denver and the far northeast of Denver. They really took off there. A lot of that was because there were no other sites in those areas that were as accessible to patients as other parts of Denver, which would have the main hospital, which would have some of our ambulatory clinics. Next slide. This is just by age, and you can see that we vaccinated an 80-year-old at our clinics. And one of the most fun things about these clinics was truly being able to vaccinate families together. And so we had 12-year-olds telling their dads to get vaccinated. And we had whole families, so grandma, parents, aunts, uncles, kids, cousins coming in to get vaccinated and taking great pictures together. But you can see that the majority of the kids that we vaccinated were between 15 to 18 years of age. Next slide. So one of the things that Denver Health really has as its core is health equity. And when we started up these clinics, I will say that when we first started, we got up and running later than other hospital systems like the Children's Hospital or Kaiser Permanente. And so when we vaccinated, we actually saw a little bit of a difference in race and ethnicity than perhaps others had seen. Part of it was because I think people who might have been early adopters got themselves their vaccines as soon as possible. And what we did was made it really easy to get in and to just walk in as well. Next slide. And so you can see in the next slide that the majority of our patients were Hispanic, and that we had a larger Black African-American population than other kind of mass vaccine sites. We impacted 3 big zip codes, which were South Denver, Denver bordering Aurora, which is kind of up on that right as it heads toward the airport, and then Aurora as well. And those are some of our lower socioeconomic status that have a lot more diverse population. Next slide. There's a lot of stuff going on here because we're getting ready for a mass vaccine clinic, so I apologize if you're having a little bit of trouble hearing me. And so that's what we're doing right now, is that we're doing basically 7 vaccine clinics for the littles, as we call them, from 5 to 11, but we're also doing boosters and first vaccines for those 12 and above. I also did the same thing where we have a combination of different school-based health centers in different parts of Metro Denver, but also added some new sites that are elementary schools. Next slide. And with that, that's the end of my presentation. Happy to take any questions.
Great. Thank you so much, Dr. Leary. That was fantastic. You guys have logistics down. That is really great. And I'm sure many of our health centers are really going to look at that information. We will be sending out the slides to all people who are on today's presentation. And also the presentation is recorded. So again, thank you, Dr. Leary. Get back to work, I guess. And I just want everyone to know, before Dr. Leary came on, she had her mask on. It was loading up vaccines. So truly a healthcare hero. Thank you.
Thank you so much.
So as we move to the next slide, we are going to introduce our partners at the Chicago Department of Public Health and Dr. Robinson. How are you? Welcome.
Hello, I'm good. Thank you.
Great. Take it away.
All right. Good afternoon, everybody. I'm going to talk a little bit about COVID-19 vaccine acceptance, particularly amongst pregnant women. So next slide, please. So what do we know about COVID amongst pregnant women? Well, this is data from the CDC website. We've had almost 150,000 cases of COVID, documented cases in pregnant women, with a total of 227 deaths and almost 25,000 hospitalized cases amongst pregnant women. Next slide. This slide just shows the cases among pregnant women and the timeline for those cases. And as you can see, the rates or the number of cases kind of go up and down as cases go up and down here in the country. So you overlay this chart with general chart of cases here in the country, they'll kind of have the same shape to that curve. Next slide. But why are we concerned about COVID in pregnancy? What are the risks of symptomatic COVID in pregnancy? An analysis of approximately 400,000 women between the ages of 15 and 44 years with symptomatic COVID-19 was conducted. And in this analysis, pregnant women were significantly more likely than non-pregnant women to be admitted to an ICU, to receive invasive ventilation or be on a ventilator, and to die. Another study demonstrated that women with COVID-19 diagnosis, pregnant women were at a higher risk of preeclampsia, preterm delivery, and other neonatal complications. Next slide. So because of this, really the best way for everyone, and pregnant women included, to protect themselves is through COVID-19 vaccination. So COVID-19 vaccination is recommended for people who are pregnant. And as mentioned earlier, pregnant people may also receive the COVID-19 vaccine booster shot. We also get questions often about breastfeeding. And yes, COVID-19 vaccination is recommended for people who are breastfeeding. And recent reports have shown that breastfeeding people who receive an mRNA vaccine have antibodies in their breast milk, which could help protect their babies. Now, of course, more data is needed on this. This is early studies about the antibodies in the breast milk, but more data to come. And then also, as mentioned earlier, COVID-19 is recommended for people who are trying to get pregnant or might become pregnant in the future, as well as their partners. Next slide. Now, I think it's important to highlight that this isn't just a recommendation of the CDC. This isn't just a recommendation of the CDC and their advisory committee, but virtually kind of all of the major medical organizations have come out and with a strong consensus for vaccination of pregnant individuals against COVID-19. So if you look at this joint statement, you can see it includes American College of Obstetricians and Gynecologists, American Academy of Family Physicians, the American Academy of Pediatrics, American College of Nurse Midwives, all of these groups who have signed on to this and basically saying that they strongly urge all pregnant individuals, along with recently pregnant, those planning to become pregnant, and lactating individuals to be vaccinated against COVID-19. Next slide. So this slide was shown a little bit earlier. This shows the rates for at least one dose of COVID-19 vaccine in the population here in the United States. And so amongst the total population, we're at about 68.6% of people have gotten at least one dose. If you're looking just at 12 and older, we're at 79.7%. As we know, our 5 to 11-year-olds were recently able to get the vaccine. So I'm sure in time we'll start to see kind of those rates based on the population from 5 and up as well. But that's about where we are. But the question becomes, where are we with vaccination of pregnant persons? Next slide. So this figure from the CDC website shows our percent of pregnant people age 18 to 49 years fully vaccinated with COVID-19 vaccine, either prior to or during their pregnancy. And this is basically from data reported from the Vaccine Safety Data Link. Next slide. If you look here at kind of the most recent data, overall, we're at about 35% coverage amongst pregnant persons. And this is data as of the 6th of this month. As mentioned earlier, you can see we've had kind of an increase over time, but right now we're still at only about 35%. So the coverage amongst pregnant persons is lower than our coverage amongst all persons currently. And there are racial and ethnic differences in that race. As you can see, the highest percentage coverage are amongst our Asian non-Hispanic persons, and our lowest coverage is among our Black non-Hispanic persons at 20.6%. Next slide. So what can we do? Next slide. I think, when we're looking at vaccines, there are some who will accept all the vaccines, some who will refuse all vaccines, and then there's a group in the middle who falls somewhere along the spectrum. So how can we help address concerns, answer questions about this? Next slide. So when answering, of course, first starting the conversation, assuming that the person is planning on getting vaccinated. When do you plan on getting vaccinated, or how can I help you? And then continue the conversation by describing benefits, being honest about side effects, addressing concerns, making a strong recommendation, and sharing personal stories. Next slide. So what are some of the benefits of COVID-19 vaccine and pregnancy? The vaccines remain highly protective against severe disease and hospitalization, and that's including the variant. Receiving a mRNA COVID-19 vaccine during pregnancy reduces the risk for infection and therefore reduces the risk of those severe outcomes in pregnancy that we heard about a few slides ago that were shown in those studies. Another area where there's more study underway is that antibodies may be passed to the fetus, possibly providing some protection against illness after birth. And this is coming from some studies that have shown antibodies against COVID-19 in cord blood from mothers who had been vaccinated. So there may be some protection to the fetus. More data, of course, is needed, and more studies on this topic are underway. Vaccination protects other children and family members by reducing the chance of illness and reducing the chance of transmission. And of course, it protects the community by increasing herd immunity in that community. Next slide. I'll get a lot of questions about the safety of COVID-19 vaccine in pregnancy. The New England Journal of Medicine report summarized results from 3 surveillance systems. There is the VSafe registry, which is the voluntary enrollment on the smartphone, where after you get the vaccine and they text you and ask you to tell them about any side effects that you've had after the vaccine. VSafe also, there was a VSafe pregnancy registry, which enrolled over 3,000 persons to follow up for 12 months for birth outcomes and other adverse events. And then they also looked at the VAERS reporting or from the Vaccine Adverse Events Reporting System. Next slide. So the VAERS reporting, or the Vaccine Adverse Event Reporting System, is a passive surveillance system established in the 90s. Anybody can submit a report to VAERS, and VAERS is really used to see if there is a signal of concern or if there is something that seems out of the ordinary that requires further investigation and further study. Reports in VAERS in and of themselves do not indicate necessarily that the event reported were related to vaccination or not. It's just a capturing of a system of any reported events and used to see if further study is needed. So providers are required to report adverse pregnancy events resulting in hospitalization and congenital abnormalities. So there were, during this time period of the observation, there were 221 reports made to VAERS. 155 were non-pregnancy related events, and then 66 were pregnancy or neonatal related events. There were reports of 44 spontaneous abortions, 3 stillbirths, and no congenital anomalies. So to investigate this, they actually looked at the rate of these events amongst persons who were vaccinated versus amongst persons who were not. And I'll show that table here momentarily. Next slide. Another question is, what about side effects following vaccination in pregnant versus non-pregnant women? And so here you see a comparison of side effects as reported by pregnant versus non-pregnant persons for both the Pfizer and Moderna vaccines. And as you see, side effects reported were roughly the same for pregnant versus non-pregnant women. Next slide. And then look, the results from the Visa Safe Pregnancy Registry. What they looked at was the incidence of, or the percentage, I should say, of pregnancy loss and neonatal outcomes versus in persons who had been vaccinated and who were in the Visa Safe Pregnancy Registry versus the published incidence for those events. And as you can see, there was no significant difference in the outcomes seen in people who were in this V-Safe pregnancy registry versus the baseline published incidence for these events. Next slide. So when addressing concerns, common questions, what are vaccine side effects? Are they worse if you're pregnant? And the common side effects, as demonstrated in the previous slides, were similar for pregnant versus non-pregnant persons. They can have headache, fevers, chills, muscle aches, very similar rates between the two groups. And is the vaccine safe for my baby? Thousands of women have been monitored since receiving one of these COVID-19 vaccines through VAERS, through the Be Safe Pregnancy Registry, and there's been no increased risk of preterm birth, spontaneous abortion, lower birth rate, or birth defects have been reported in persons who were vaccinated. Next slide. Other common concerns you hear, we probably heard them. Does it change my DNA? No, it does not. It does not enter the nucleus. It cannot change the DNA. Does it cause COVID-19? It does not. And then a common one we hear, does the COVID-19 vaccine cause infertility? And no, there are no reports of infertility in men or women have occurred following vaccination. Next slide. Other resources that may be helpful in conversations with patients around COVID-19 vaccine for pregnancy and breastfeeding. ACOG has an FAQ that addresses many common questions and concerns. And then they also have this discussion guide for clinicians that kind of talks through each of these, the risks associated with COVID-19 infection during pregnancy, safety, efficacy, and all the other topics are in this discussion guide for clinicians. Next slide. Another thing we have here is for people looking to get more information, and this is a great course, not just for medical personnel, but for lay persons who are really interested in learning more about COVID-19 vaccines and becoming a vaccine ambassador. There's a free online course that is done through our City Colleges of Chicago. Next slide. It's an online course, self-paced, takes a couple of hours, but really in the course, students learn about the background of COVID-19 vaccines in the U.S. healthcare system, the history of mistrust and the root causes of vaccine hesitancy, answering most frequently asked COVID-19 questions, and how to approach difficult vaccine conversations. So these are all topics covered in this course. Next slide. Another thing is to share a personal story. I think it's also very helpful, to share data and to share science, but sharing our personal stories about why we chose to get vaccinated, pregnant women sharing stories about why they chose to get vaccinated are also very powerful in terms of helping others make that vaccine decision. Next slide. So thanks for your time today, and I will turn the presentation back over.
Great. Thank you so much, Dr. Robinson. That's fantastic information for our pregnant patients and moms, and we really appreciate the information. So thank you. Okay, well, now we're going to turn our speakers over to 3 of our health centers. First, we're going to hear from our partner, Dr. McPhee at Tampa Family Health Centers. Ashley, are you with us?
I am here. Good afternoon, everybody. So first, I just want to say thank you to everyone for having me today. I took a little bit of a different approach because we are just getting started with our COVID-19 vaccines for the ages 5 to 11 at Tampa Family Health Centers. Next slide, please. So I wanted to tell you a little bit about us. We are a total of 16 healthcare centers. 12 of our centers have dedicated pediatric providers. We do work really closely with local schools and shelters, trying to make sure that we get the vaccines out into the community. We are one of the largest amongst the FQHCs in Florida. Next slide. So early on, when this vaccine was coming out, there was a lot of hesitancy, not only from parents, but also from staff. They were really nervous about how to get the message out, the administration of the vaccines, several things like that. So we started with prepping the staff about 1.5 weeks before approval came out because we knew that this was coming. We provided resources for the providers and staff for commonly asked questions. We also provided resources to them on how to administer the vaccine, what that would look like, and how to answer the tough questions. Next. So that education extended to really getting down to the nitty-gritty of how this is administered. It's a big vaccine, so it's scary for our staff because they don't want to mess this up. They realize that this is our kid's shot, and they want to make sure they get it right, and you are handling people's children. The other vaccines, they're used to doing their routine for them, their routine immunizations. This was different for them, and so they wanted to make sure they got it right. So what we did is we printed cards on how to administer the vaccine, and we put that in each of our medication rooms. They are on all of the counters so that when they go in to draw this vaccine, it's there for them. So we use that as a way, steps to mitigate vaccine errors. Next slide, please. And we distributed the vaccine. So we are ordering from HRSA as of now. We are not ordering from the state at this time. We have 7 sites that were designated vaccine sites for HRSA, and we have all vaccines sent to our admin location. From there, they're couriered out to the vaccine pending size and use. So we track all of that at end of day. We send out vaccines weekly as they go through, and then if they run out and they need more, we send additional vials at the same time. Our stock is separated. Most of our centers have 2 separate med rooms. So we have a private stock med room and we have a VFC med room. So it makes it easier to separate out the vaccines and keep them stored. Next slide, please. So we really just began vaccination this week. We began last week with our social media campaign, our updates on the website, and then we leveraged our EMR for messaging to qualifying patients to let them know we have it available, come on in. Next slide. So the most common questions that we've been getting is, can my child get the vaccine if they've had COVID-19? My child is about to turn 12. Which vaccine should they get? Will a COVID-19 vaccine alter my child's DNA? And of course, the concern about developmental issues. So these are the kinds of things we try to give the providers and the staff handouts and information on ahead of time so that they knew what would happen. After we distributed those vaccines to the 7 sites, we really got started with administration on Monday. We have created vaccine schedules that are on our 7 clinics, and we don't separate adult from peds. We allow patients to schedule appointments for vaccines, but we also allow them to walk in on that schedule as well. And so we have the LPN or the nurse or the medical assistant that's available call that patient back and administer the vaccine at that time. I will say the 7 sites strategically have pediatric providers there. We saw this coming before, so that way we can leverage that vaccine as much as possible. Our call center is also aware that we are popping the top on these. We let them know, and so if patients are calling in, hey, I popped the top on my Pfizer, send whoever you can, so that we can try to not waste vaccine where we can, but there's never an instance where we won't vaccinate a child because we're scared of waste. We want to make sure that we vaccinate as many children as we can. And so this is a really short presentation for me because we're just really getting started with this, and I don't have numbers to present to you guys yet, but I am really hopeful. I had plenty of questions. I'm a pediatrician myself by trade, so plenty of questions from parents about when I was going to get it, and so I have my schedule pretty packed with kids coming in for the vaccine. So I'm excited about where this is going to go. I'm excited to maybe talk about this a little bit more down the road and tell you guys how well we're doing. I would love to have numbers like some of you guys have already, and I think that we will. But we've really laid the foundation to be successful. Thank you.
Great. Thank you, Dr. McPhee. You guys are doing great work in Tampa and the Tampa area, and great job in your position there. So appreciate it. So, and we will be bringing back Dr. McPhee to here in the future. So let's turn it now back to Chicago, and we are going to hear from our partner, Dr. Schaefer from Heartland Health Centers. And I think, Emily, you're just on the phone, I believe, correct?
Yes, thank you. Can you hear me?
Perfectly. Take it away.
Wonderful. So thank you very much for asking Heartland Health to share our experience thus far with vaccinating the pediatric population for COVID-19. We were quite delighted to have been one of the first clinics in our community to offer the vaccine upon CDC approval, and it's very promising that the demand appears quite high. Heartland Health has approximately 3,600 patients in this age group across 10 community sites, and we have an additional 2,100 patients at our 7 school-based health centers. So I know that we were asked to highlight the work that we're doing to provide these vaccines to this population and discuss, our strategies, successes, challenges, and such. So I'll start by saying that CDC approval of the Pfizer vaccine for ages 5 to 11 was incredibly highly anticipated and closely watched, and therefore we started the ball rolling with planning and preparation by remaining in close contact with CDPH regarding our vaccine order. Once we received the request to place a bulk pre-order, we knew when to expect our doses, so that was very helpful. And we also began training our staff, much like Dr. McPhee had mentioned, training them with regard to the new formulation, dosing and preparation, and there were webinars which were made available by IDPH and Pfizer, so that was also very helpful. And in addition, we started setting up Saturday mini clinic schedules and staffing to accommodate patients en masse. So because we were so proactive in our efforts, Heartland Health was able to host our first pediatric vaccine event on Saturday, November 6th, which was just 3 days after CDC approval and receipt of our dose order. Very exciting for us. Invitations were sent via text to eligible patients' parents, and our hotline team was ready to take calls to set the appointments. And for this, the families were very grateful that they were having access to the vaccine so quickly. I can tell you that the first event yielded a 75% show rate. Our second event days later had a 91% show rate, so there is still work to be done. But we are pleased to say that in our first week, Heartland Health vaccinated 356 kids aged 5 to 11. And this also included our participation in the Chicago Public Schools Vaccine Awareness Day. So we are planning more community events, and our school-based health centers will be vaccinating students on Fridays for the foreseeable future. We will also continue to reassess the demand and our need for to open up any additional access as we move forward. So in terms of challenges, we are still seeing swaths of uncertainty and hesitancy in our community. So we have our outreach teams out there working to educate and facilitate acceptance. We understand that this is one of the key factors in bringing the pandemic to an end by vaccinating these school-age children. So our goal is to ensure that we're doing everything that we can to meet the challenge. Again, just very excited that we were able to get this out so quickly, and that's all I had. I'm sorry I didn't have any slides or anything. Again, this is very new for us, so we were just doing it for a week. But like I said, we did vaccinate 356 kids, and we're hoping that those numbers, continue to grow. I can take any questions if anybody has anything.
Emily, that is great. Thank you so much. And for this webinar with moms and kids, we wanted to hear just what your story is at Heartland, so that was fantastic. I think people might be putting some questions in the chat, which we may or may not be able to get to later. But again, I want to thank you for your time and letting us know what's going on at Heartland Health Centers in Chicago. So thank you.
Thank you. Thank you.
So I think next we're going to turn back to Miami and in Florida and turn to our colleagues at Jesse Trice Community Health System, both Joanne and Keisha. How are you guys? We're going to give them a minute.
Hello, how are you?
Great.
Thank you for having us. Okay, so hi everyone, I'm Keisha Wilkerson. Signing in today on behalf of Jesse Trice Community Health System, who's been around Miami-Dade County for over 50 years. We've been servicing this county. We are located, we have approximately 14 sites. We do have 40 clinical sites within our Miami-Dade County Public School System, where one of those sites function as a primary care system. We also have a women's residential center, and we're also located inside of one of our universities here in Miami-Dade County. So we've been around, we are servicing the community. We reach out to many of these local politicians, and we have partnerships, and we have been enforcing and pushing and really trying to get this COVID vaccine administered to as many people as possible. And so today I have with me my peer, Ms. Joanne Pierre, who is our school health director, and she'll begin with our presentation.
Hi, good afternoon, everyone. My name is Ms. Pierre Joanne. I'm the school health director for Jesse Trice Community Health System. We have about 40 school-based sites out in Miami, scattered within our Liberty City area, North Miami area, and Hialeah Gardens area, and also Miami Gardens. Next slide. We just wanted to give a little bit of overview about where we're at. There are about 72.8 million children under the age of 18 in the US, 22% of our population. Children ages 5 to 11 just became eligible for COVID-19 vaccination, representing at least 8.6% of our US population. The Pfizer BioNTech COVID-19 vaccine was approved by CDC in person for ages greater than 16 on December 12, 2020, following an EUA from the FDA on December 11, and on May 12, 2021, CDC approved the use of Pfizer BioNTech for ages 12 to 15, following the vaccine EUA granted by the FDA on May 11. And the FDA also issued an EUA for the Pfizer vaccine for kids age 5 to 11 on October 29, 2021, followed by Academy of ACIP recommendations and CDC approval on November 2nd. Next slide. This is just a slide showing that how we can contact like certain areas based on zip codes, which is if you text zip code to 438829 or call the 1-800 number, you can find a location near you. Since COVID has started back in March 2020, School Base has been out within the community actually testing and also vaccinating adults prior to children. I just wanted to mention that. Next slide. These are some benefits that with our parents and children can benefit from. Vaccinating children can help protect family members, including siblings who are not eligible for the vaccinations and family members who may be at increased risk of getting very sick if they are infected. Vaccination can also help keep children from getting seriously sick, even if they do get COVID-19, as we know. And also vaccination children ages 5 and older can help them keep them in school. They can participate in sports, play dates, and other group activities. Next slide. This is just our data across the nation, a tracker system. Everyone is familiarized because I've seen it, that how many people have been vaccinated so far within our age groups, different age groups. This is based on CDC. Next slide. This slide is about COVID-19 vaccine dosage and administrations for children and teens. Adolescents ages 12 years and older receive the same dosage as the vaccines as adults. Children ages 5 to 11 receive 1/3 of the adult dose of the Pfizer BioNTech COVID-19 vaccines. Smaller needles are designed specifically for children and also used for children ages 5 through 11. Next slide. Possible side effects. Some individuals, they may have no side effects, and some, because of their severe allergies, may have some reaction. But the main concern would be, per CDC, to watch out for myocarditis or pericarditis after vaccination. They must seek medical care or 911 immediately. Although myocarditis and pericarditis have rarely been reported, especially in adolescents and young adolescent males within several days after COVID-19 vaccination, per CDC. Next slide. The role of the school nurse, and our role is to make sure parents are not too anxious when hearing about vaccines. So there's a lot of vaccine hesitancy, and it's a significant barrier to the eradication of vaccine-preventable infectious disease. So nurses are in a unique position to enhance COVID-19 vaccines uptake, giving them ranking as the nation's most trusted professionals. And school health is just in that unique position to promote vaccinations. Next slide. Some of the conversations we had with parents start with being in a place of being empathetic and understanding, assuming that patients will want to be vaccinated, but be prepared for questions, give strong recommendations as healthcare providers, address any misinformation by sharing key facts per CDC literature, listen and respond to patient questions, and being proactive in explaining the side effects of the COVID-19 vaccines or any vaccines, childhood immunizations. Next slide. Some strategies that we enhance vaccination compliance. We actually want to make sure that our patients or students can access our clinics, actually, our primary care sites and our school health sites as well for vaccination. We engage with local community leaders strategically to get their buy-ins. We also had meetings with the school district, Miami-Dade County Public School Districts, parents, school officials, principals, teachers. We have quite a bit of meetings with them for this rollout. We also wanted to dismiss any concerns about COVID-19 vaccines because of the lack of data with the long-term safety of the first vaccine with the COVID-19. We also wanted to reinforce the adverse consequences of COVID-19 and understand that the vaccine is protecting them from so that they are able to balance the risks and benefits of vaccination. Next slide. The nurses, the school nurses' roles, they helped prepared most of the time throughout the day. They were identifying cases, COVID-19 cases among students, staff, educators, and potential exposures to the COVID-19 and outbreaks that may occur within the school facilities or any type of sports events within the day. Promoting vaccination to eligible students, staff, and educators. The nurses also have the ability to verify within the Florida State Registry, the database, for students who are out of compliance, doing follow-up calls and letters to parents. We provide ongoing training for COVID-19 vaccines within our organizations, with our school health nurses as well, and also Florida Shots provides updated webinars in regards to COVID-19. We also promote behaviors that would reduce spread of COVID-19 by wearing surgical masks on site, physical distancing, promoting hand washing, teaching our students about hand washing or any respiratory etiquette. We also try to maintain a healthy environment by cleaning and disinfecting in between clinic areas or any high usage areas. Next slide. Ongoing, we do daily huddles with our nursing staff and providers to keep abreast of any updates for COVID-19 that is being addressed. We also have an on-site pharmacy and drive-through or viable options available for eligible individuals for the COVID-19 vaccines. We do encourage fast track appointments, including same day appointments with our 5 pediatric locations. We have a nurse practitioner, which is at one of our hubs, our primary care site at one of our schools, Miami Northwestern. We're able to refer our students to our Jesse Trice primary care sites if they need any other specialty services. Access to our system by scheduling appointments. We have a portal system. We have a communication plan with all of our patients by text messages, patient portals within our exam rooms, our waiting rooms. And we also have this Pepper, which is a robot who can deliver patient education, entertainment while waiting, and hand holding. We also try to leverage as much partnership with our local health department, the school board, and our funder, which is the Children's Trust, and other community-based partners to provide childhood and adolescent services. We use different platforms such as social media, Twitter, to boost up communication with our parents in our community about vaccines. Next slide. This is a sample of our workflow. The nurses would usually gather all the parental consents unless 18 or older. We do provide the EUA and the vaccine info provided for the COVID-19. We try to schedule our vaccination fairs with the local school board and everything, with the principals, and everyone is involved. So usually we confirm the dates with the school board, the school principals, and of course we're going to follow up with parents. The school nurses then administer vaccines on site at that particular location. We have our emergency supplies on hand. The cards are given to the parents, and also the EUA fact sheet is provided. Then the nurses, we have staff that's available to enter right away into Florida Shots Registry. We do a callback reminder for the second vaccination dose, and as well as the second dose is administered and entered into the Florida Shot Registry. Next slide. Our drive-through services we have within our 2 locations. It's usually Monday through Friday and on Saturdays. Thus, so far, from January to, I would say, up to September, we have administered at least 639 doses to date for students that are 12 years and older. If we're unable to vaccinate children through our drive-through services, we give them a fast-track appointment in our pediatric clinic. And we do regular monthly schedule rotation with a mobile unit at the school sites, if possible. Next slide. Our rollout actually with the Miami-Dade County Public School actually started last Friday. We had a great turnout. We have administered actually, it's actually 87. And today, as of today, we've vaccinated 104 children between the ages of 5 to 11 at 3 of our locations, because earlier I was at a location. Some of the challenges were having parents completely fill out our screening forms to ensure that they are not allergic to anything or have any chronic conditions. At times, parents are sending symptomatic students to school, so we're tasked to actually assess them to make sure that they're healthy. Some of the wins, we've had great turnouts from parents and students, and so far we have no adverse reaction noted thus far. Next slide. That's it, and I'm open for any questions.
Great, and thank you. You guys are doing such phenomenal work at Jesse Trice. We want to thank you for your time today, but more importantly, thank you for all the work you've been doing over the past several months with this. So again, thank you.
Thank you.
So if we move forward to our next slide, we're gonna want to just say thank you. Thank you to all of our speakers today, our panelists today, our healthcare heroes today. And on behalf of Alliance Chicago and Health Choice Network, we really value all of the input that everyone has been doing over this pandemic. So again, purpose, innovation, and partnership across networks connecting communities. I think on our next slide, we want to just say thank you to our sponsor for all of us, HRSA, who allowed this webinar to get funded. We appreciate that award. So again, on behalf of Alliance Chicago and Health Choice Network, I hope everybody has a great day, but more importantly, I hope everybody has a safe, healthy, and relaxing Thanksgiving next week. Have a great day, everybody. Bye.
Thank you. Goodbye.